Okay, hello everyone. It's my pleasure to welcome you all to this very last CIVICA seminar for 2023. And before I hand over to our speaker for today, Dr. Divya Srivastava, I'll start with a few housekeeping points. So today we'll have our talk in a few minutes, and it's going to last until 3:45. After that, we'll have the question and answer session lasting until 4:00. And this talk, as usual, is recorded. You can ask the questions either by typing them onto the chat or by raising your virtual hands. So now I'll, as usual, introduce our speaker for today. So Dr. Divya Srivastava, as I said, she is from our very own London School of Economics. She's also from our own very own, she's an affiliate from the Data Science Institute, where we're hosting this talk today. And she's a guest teacher at the Department of Health Policy. She's an economist who specializes in health financing, digital health technologies, as well as comparative health policy. She's worked at the OECD in Paris, as well as the WHO European Observatory on Health Systems and Policies in Brussels. And she's also worked for Canadian and British national institutions. She's also provided consultancy advice for international organizations, national governments, and the private sector. And today, she's going to tell us about a framework that she and her team have devised on promoting the systematic use of real-world data and real-world evidence for digital health technologies across Europe, and specifically countries like Estonia, Finland, Germany, Italy, and the United Kingdom. So over to you, Divya, if you want to add more to what I just said and to your talk.
First, thank you very much for having me, and it's a pleasure to be here. And thank you for that really kind introduction. That was great to sort of set, I guess, the context of what I'm going to be doing today, and I guess the approach I'm going to be taking. So I am going to be talking about data and evidence with respect to digital health technologies. And what I'm going to share with you is actually a paper we've now published, and I think that can also be available if you'd like to access that in the links afterwards. And what I'm going to talk through is really, why we did it and what we found. And I'm looking forward to your feedback and reflections afterwards. So in terms of how I'm going to break up the presentation, I'm going to talk about what we mean by this. If you are familiar with this topic, then that's great. If you're coming from it from a different area of expertise, I'm just going to tease out what we mean by this notion of digital health technologies in healthcare, and why we did it in terms of what was interesting us about looking at this issue in particular, and how we went about it. So what type of methods we used. I have been trained quantitatively as a researcher, and this was a shift in my, I guess, research activities as well, because we did what is called a Delphi consensus exercise technique, which would be more grouped under a qualitative approach and understanding, in this case, a framework that we wanted to develop. So I'll talk about what we found, and then I'm going to turn to discussions afterwards, and then open it up for questions as well. Now, the first thing I just want to share with you is really about what we mean in this notion of digital health technologies. And I've just put up here two sources of information that do talk about this quite a bit. And one actually is from what's called the National Institute for Health and Care Excellence. The acronym is called NICE, if you haven't heard of them. And they're called an HTA body here. HTA here stands for Health Technology Assessment here for the UK. And they've defined digital health technologies as what is written on this slide. So they will look at apps, they'll look at programs and software, including obviously AI in the healthcare system. And they can look at these products, which either might be on their own a device that does some type of diagnosis or comes to some conclusion, or it supports clinical decision making and does some type of diagnostic test and supports that. The other one that's come out probably around the same time is from the World Health Organization, and there generally is some similarity in what they're using in terms of their wordings as well. So the WHO came out back in 2019 looking at specifically mHealth or mobile health and mobile wireless technologies, as well as they were thinking about the whole area of advanced computing sciences and big data, genomics and artificial intelligence. So you can see that there is some convergence as well around some of these notions of what we mean when we come to thinking about digital health technologies. Now, specifically for our paper, we want to look at two concepts. We want to look at real world data, or RWD, and real world evidence. What we want to do in terms of starting this off is looking at what was known about this concept with respect to the healthcare system. And the Food and Drug Administration in the US has published some definitions for both of these concepts. And we used that in our application, in our study, in part because they had come out with this and it's quite a well-established definition and could be very helpful in the context that we were looking at. So what do they mean by RWD, or real world data? Well, they look at all types of data sources in this case. They look at data relating to the patient's health status or where it's coming from. And in terms of the types of sources, it can be a variety of places, actually. They can be held in what's called electronic health records, which is what obviously looks at the activity of patients in a healthcare system. It could also be looking at, if you have a private insurer or a public insurer, they're looking at obviously activities. They might look at claims and billing activities. There's also a growing area of understanding diseases among the population. And so there are things called registries around product and diseases, actually, which collect a whole host of information in this area. And now moving into digital health, there's obviously being lots of data generated, as I just mentioned. And what they refer to this idea is patient-generated data. And this could be something even happening in your home. If you have a certain type of device or platform where you're, for instance, sharing information remotely with your specialist or your healthcare provider, that's patient-generated data, which could be useful. So that's kind of the idea of where data kind of sits here when we think about it with respect to health and digital health. What do we mean by real-world evidence? Well, they came up with a helpful sort of guide on this as well, and they look at RWE in the sense of it's clinical evidence. And it's trying to understand the benefits and risks of a product. And it's coming from analyzing any type of real world data that we have. And again, the type of evidence that's being used here, which is very relevant for digital health, is that it can come from different types of methods. It could come from different types of study designs, different types of analysis. It's not limited to what is commonly used in the healthcare field, a randomized controlled trial. It could include other types of trials or what's called a pragmatic trial. It could even be something more observational. It could be looking at something retrospective or prospectively. So we used these two kind of broad ideas and tried to apply to understand how are countries trying to engage with both of these with respect to digital health technologies. The other two terms that came up in our literature search in understanding this have to do with really drawing on what we know about pharmaceutical products or medicines or medical devices. And I want to share those two ideas with you because they were relevant for our research. The first one is called post-market surveillance. And this is an idea where countries will collect information in a systematic manner about how manufacturers are how their products are working in the market. And what this does is that it helps regulators who are trying to understand, for instance, the safety of a product that's on the market. It could be a new medicine, it could be a type of diagnostic device. And it lets them understand and balance the safety and the risks associated with the continued use of these types of products. And that's really important to figure out whether or not these products should stay on market. So in the past, there have been things that have been recalled, for example, and that would be drawn from information that happens when you collect information on that product once it's available on the market. The notion that's connected to this is something called pharmacovigilance, which I wanted to share with you. And that's used specifically around medicines and vaccines. And again, the World Health Organization has set out a helpful sort of idea about how we think about it, which is really to understand once a medicine is on the market in any country's market or healthcare system, are there adverse effects? And do these adverse effects, again, outweigh the benefits of that product continuing to be on the market? And they will use this type of information to understand its impact once it's on the market. So taken together, we want to look at a few things in understanding, well, where can we place these ideas with respect to digital health technologies. And we first want to understand what is the evidence on any digital health technology and how does it work. What we found in some of the recent reviews that have happened, which has been very helpful, is that in one review, they looked at apps that are used in the area of mental health, specifically around depression, low mood, and anxiety. And what they found is that they're only working really well in research settings, not really in the case of clinical real world settings, actually. So there is this issue around whatever is out there at the moment, how well is it working, for example. Another area, just as an illustration, is around diabetes. And so there are a number of applications that you can have on your phone, for example, that might track your sugar level. And out of a big evaluation that was completed, only a handful were found to be showing any type of clinical meaningful improvement. And again, there was a question around the types of methods that were used. So this evidence gap is another issue that's coming up when trying to understand, well, what can we say about these types of digital health technologies? And then to take it a step further, what kind of evidence do we actually need to know whether this technology works or not? And so the last part I just wanted to do in terms of setting this up is the Food and Drug Administration in the US actually tried to look at real world data, or RWD, and real world evidence, or RWE. And they actually, for an example where they gave a product, what's called here, that they can come on the market, or a term we use called market access. It was in the case of looking at natural cycles for the pregnancy cycles for women, actually, and they allowed the information that users used when they tapped in their information into an app to use that to show how this type of app that helped them understand their cycles was used and allowed to then be available in the market in the US. And this was just coming from users that were using it, in this case, around 15,000, to inform that decision for this regulator, which is the FDA in the US, to decide that this product in this case can come onto the market. Now, I guess this against a backdrop, where did this sit in terms of our motivation? Well, what it led us to do was to think about, well, actually, what we're finding is that there is a lot of data being generated in lots of different settings. The other idea is that if there's a lot of data being generated, what can we say about that data? So is it helping patients decide what they want to do? Is it helping healthcare providers? Is it helping regulatory bodies or health technology assessment bodies to think about if it's working or not, if it should be available? Should it be paid for? It could also inform the type of evidence that might be needed and how you can monitor the technology as well, and whether or not it's generalizable. So if you see this one technology working, is it going to work in the whole population or not? So there's this whole thing around how this data could be used. The other part that comes in as a challenge and an opportunity is that so much data is being generated. It's happening across lots of different settings. So there's lots of questions around interoperability here, and whether or not that is obviously going to be a benefit in terms of all the data that's being generated. There's also this issue around trying to understand, well, if it's on the market, then in the case of digital health technologies, how well are we sort of understanding its activity once it's allowed to be on the market, or what's the post-market kind of surveillance looking like in this case? And it's very new in its infancy in many country settings. And then to extend this further, when I was talking about pharmacovigilance and understanding, if a medicine has adverse effects, should we be thinking about this notion of some type of vigilance around adverse effects for digital health technologies? And there's nothing there right now in this space that we wanted to then challenge and explore. So that takes me to our paper, which is called Promoting the Systematic Use of Data and Evidence for Digital Health Technologies. And we looked at it taking a European context. And my co-authors are there on the page as well. And it was published in Health Economics, Policy and Law, if you would like to continue reading this further. So in terms of what we want to do, our question was trying to understand what are the opportunities if there's all this data everywhere. Can we think about systematically embedding it into countries' decision-making to inform them about these digital health technologies? So we have this objective of trying to look at first, what are the current kind of activities underway in countries, and what could be the potentially future opportunities in these countries. And we looked at 5. In this case, there were Estonia, Finland, Germany, Italy, and with a focus on England and the United Kingdom. And then we also wanted to understand, well, okay, this is what we know from the literature. Then how can we take that a step further to say, if we want it to be systematic, is there some kind of framework we need to be thinking about collectively that could sort of inform how we draw and marry the literature understanding that we are going to get from this research exercise? And so we did what's called a Delphi consensus framework building consensus framework technique, which is where we drew in an international group of experts, really, and asked them a series of questions to try to come to a consensus around thinking if we could propose a framework. And that's the second half of what we did in our paper. Now, when we looked at the methods, we looked at what was happening and being published in these countries. We did a mix of trying to understand what's in the literature, also gray literature. And because we want to know what are governments doing in this space as well, we had to look at sort of government types of documents as well, and if there are any relevant databases in this case. And what we found and kind of reflected on is that the countries that we have looked at in part reflect the author expertise and research study team, but they also reflect different approaches of how they think about healthcare, how they think about delivering their services. So is it very centralized or decentralized? How do they pay for them, or what is the financing picture looking like? Are they promoting the adoption of technologies or not? How is the population used in terms of the collection, use, and sharing of data that could be relevant here? So we have a series of keyword searches that I just put up there on the screen, but we really want to understand and take further is trying to look at, is anything in place happening in these countries in terms of their frameworks? Is anything happening in terms of national efforts? Are there other ongoing opportunities, and where could we then take that further in terms of embedding this type of data and evidence when we look at digital health technologies? So we did an approach around the methods where we also then did what's called a 3-round Delphi consensus technique. For those of you who are familiar with this technique, we ran it at the end of between September and November of last year, and the sample sizes are there in terms of the participation that we had. We did it through an online survey platform to run this exercise, and we contacted a host of networks that we are kind of tapped into internationally. The type of experts range from it being scientists and researchers to healthcare professionals to payers or national regional institution representatives from those institutions to patients or patient organizations. And these were all identified and contacted, and obviously through this type of a collection exercise, they gave us consent to be part of this activity, and they obviously shared information on what we were doing with the study. How this exercise works is that we gave them a series of statements, and then we wanted them to rate how important that statement was, they felt, from their perspective in terms of including that or not. And there were kind of 5 options they had, from excluding it to obviously essential to include it. And we did them through, in the first case, a Qualtrics platform, which is an online survey platform. And then we went and used something called a Delphi consensus tool once we had this information, because that allowed us to transfer the information over. And what happens is that every time you do a round, you get feedback from the participants on what they are agreeing on and what they're not agreeing on. And then you can see by each statement, in this case, is what we had presented to them, are people kind of gathering around a certain statement where they really agree or really disagree, or is there kind of a wide variation in answers? And as we got to more consensus, there was definitely opportunity for all the experts to give us their feedback. This was all anonymized, and then we could reflect that in if we had to update the statements. And so we did that through the rounds, which is why you have more than one round to sort of reflect on the feedback, update your statements. And then again, the experts can also see how they have rated things in the previous round, if they want to reflect on what they want to do in the next round. This kind of allows an iterative process in thinking as well. Just to kind of give you a bit of background on the country characteristics before I move to the results. So we had 5 countries, Estonia, Finland, Germany, Italy, and United Kingdom, with a focus on England. And I've just put up here some aspects of the country's healthcare systems that, for our purposes, was actually useful to understand in terms of how they actually deliver their healthcare, how they finance their healthcare, whether they are adopting the technologies and public perceptions of it, and how that's sort of changing, or is it common across. So for example, when you look at Estonia, just on the left-hand column, it's quite a centralized model of delivery. How they actually get their money to pay for healthcare comes from a few different sources, which is listed there in terms of taxation and wage-related income distribution, contribution. The use of technologies is very widespread in Estonia, and public perceptions of the use and sharing of data is very strong. So there's obviously a shift compared to, say, Germany, where there's more growing interest around public perception of the use and sharing of data. So we wanted that to kind of understand what is sort of the baseline, where are these countries coming from when they think about digital health in particular. Just a bit on the respondents that did the Delphi exercise. So in terms of the demographics, there was a mix in terms of their age. So about more than half were between 40 to 59 years. The gender was fairly split. these are the main countries that we had in terms of the expertise, but we also had countries from outside the 5, from the Netherlands, Austria, Greece, from the USA, Switzerland, and Turkey. And their affiliations were quite broad as well, which was great. So we got quite a mix of experts coming in to weigh in on their views when it came to the type of statements that we were presenting with them. So that gave us some confidence in how we were trying to sort of obviously get the reflections in the Delphi part of our research. So I first want to share with you a bit on the literature review on what we found in terms of some themes that came through. So they've all developed some type of approach to thinking about digital health technologies, but they're very different and they're at very different stages. The efforts have focused on very different areas. So some are more thinking about reimbursement or how you pay for these technologies. Other countries are just thinking about now how they collect this type of data, how they might monitor the quality of the data. There is legislation being used, but again, it's varying to the extent of how much of it is being used to sort of promote and I guess draw on this type of information. They are very different in terms of how they organize their healthcare. So some are more federated versus some are more centralized. And there was also this recognition that with the pandemic, with the arrival of COVID-19, there was a shift obviously in the demand and towards other types of technologies in digital health. So this could also be an opportunity as new sources of data and evidence in this area. And also what we found in our readings as well, that there was definitely some things being looked at, but obviously, again, there are areas to think about developing areas more systematically and embedding this type of data and evidence further in country settings. The other part I want to share with you is about what's happening specifically in the countries that we looked at in a bit of detail. So just in terms of highlighting this, for example, if you look at Finland, which is the second row, they've promoted digital type of services for a very, very long time. They have lots of different examples in what they're doing in terms of collecting data here. And what they're sort of recognizing is that they have actually set up a very good infrastructure to collect data. But they've realized there's certain groups of the population, certain vulnerable groups, certain underserved communities where they're not really getting enough understanding of how they're engaging with digital health technologies or not. And they're actually now doing some more systematic, they're now going towards systematic collection of this type of data really to inform their own understanding. So just sort of in terms of highlighting where they've gone. Germany is another one I just would maybe pull out here. So for example, really before 2019, there wasn't a lot in terms of legislation or policies that were really being actively pursued in this area. And a lot came into place in 2019. They became very keen to sort of allow lots of digital technologies to be adopted in their healthcare system in their country. And they put in a place of kind of fast tracking applications to allow these types of technologies to come through. So now they have all these technologies that are available in the market, but they've put that in place to really kind of facilitate the arrival of these technologies. And now they're asking themselves questions on the benefit of these types of products. They need to evaluate them probably carefully on the quality and safety of these types of technologies as well. So you can see that countries are at different stages of how they're trying to understand digital health technologies. The second part of the paper that I want to share with you is really around the Delphi exercise. And what we had found in terms of our statements is that there was very much a consensus around that for any given country setting, there are some kind of building blocks that you sort of need in terms of the policy scope, the institutional roles and what their scope is and what they can do and what they can oversee, and around collection of data, which is obviously really important. And consensus here ranged between 75% to 87% on the items. And anywhere for any item where we had 75% consensus, in this case would be high priority or essential to conclude, were included here in terms of our consensus exercise. So there's a side of the building block world of kind of saying, what do we kind of need in terms of an ecosystem? The other part of it is what we really want to look at is once you have something on the market, then what has to happen here to sort of promote systematic use of this type of data? And I think what we found is that there is a need to have understanding about the post-market world, to think about the surveillance that's needed here. And it really was around the policy scope of what is going to be kind of considered, because again, there is so much data. What are you going to sort of focus on? How do you decide what to focus on? And how you think about collecting all that information. So I've just listed here the rounds that we had in terms of which principles were accepted in each round. In the end, we had 16 that were reached. 4 did not reach consensus. The agreement was below our threshold. But again, looking at where they fell in terms of their kind of the relevance of it was also quite insightful to kind of know where these things fell in terms of the other principles that we were looking at. I have the next slide actually has some of these statements, which I can appreciate might not be very easily legible on the screens that you might be looking at. But I just want to give an example, for example, as an illustration. So just in the first row, you can see here there's a principle around institution. And there was consensus around the idea that you need to have some kind of central institution or agency that's going to oversee the implementation of a national digital health strategy with the support of all relevant stakeholders when you think about the collection, use, best practice of data and evidence. So there was, huge consensus around, yes, we need institutions to be sort of doing this. What about the collection? Well, you need to have data that's going to obviously think about users' informed consent that follows the country's legislation and guidance on data protection. So just, very obvious things, but it's not apparent in countries at the moment that they're kind of reflecting on this immediately in their policy documents. So we set out these in terms of building block principles, and there were 8 of those. And then we had the one around post-market surveillance and understanding what happens once these products are on the market, which led us to think about something around digital health technology vigilance, or really around understanding, any adverse effects around these types of products. And I could say that these 8 principles really fell under collection. So really going into the detail of maybe the methods that should be considered, how comparable they are over time, what the scope needs to be for decision makers in terms of understanding and supporting data and evidence in this area. And so I think what we found is that you really need to kind of think about both of these in the round to kind of promote a framework that's going to be consistent and robust. We pushed ourselves a bit further to think about, okay, we have these principles, but when you think about digital health technology, can we sort of think about it in a sense of where this product is in terms of its development, or whether it's now on the market. So we kind of reflected on an idea that's used to think about any kind of, in this case, a healthcare product like a medicine, looking at something called the total product lifecycle approach, which is one way of thinking about it. And what this really is just showing you is an idea that in this kind of circle, you have the area that's called design. This is where you're sort of developing your proof of concept, trying to figure out whether it's working. And you might need to understand like the risk and the functionality of your product. And then you go to something called pre-market, where you're trying to understand, is this thing going to work? Do we need just kind of evaluation around it? Can data or evidence in this respect help inform that? And then you get to a world of where hopefully your regulator has approved your product and they want to look at, the outcomes and safety of it. And then you're going to think about, okay, if it's now, showing that it works, then how are we going to pay for it? If it's from a government perspective or a private health insurer, what would they need in terms of informing them on how they would price it? And then once it's on the market, you think about, well, okay, now it's there available. Do we need to think about what type of data and evidence we need to sort of support our understanding of it? Should the evidence thresholds for ongoing monitoring be flexible here to understand that? So you want to sort of look at it in terms of the different evidence needs that speak to this. And what we found in terms of our thinking around the principles is that they kind of fall in different places of this, but they're also very relevant. So for example, there's a role for institutions to play here in terms of understanding, the oversight and guidance of it. On the policy scope side, it's necessary to think about the design of how we think about these policies, and technologies, how inclusive are they when we reflect on the priorities of them. And then on the collection side, that could inform things around recommendations or how we think about protecting the type of data that's being used and privacy concerns, and how we reflect issues around data sharing and in which settings they should be shared. The last part I just want to share before we open up for discussion is around, okay, once the product is on the market, do we have to think about, how well it's working? And really there were 2 themes that came through in terms of there's a policy scope angle to think about how it informs clinical decision making. Does it change that view? And we can think about its benefits and its quality, is it accessible? And then on the collection side, what types of characteristics of the data are important that we want to collect? Does user experience matter here? Do we want to collect information on that? Do we want to understand, what's working well in terms of the collection methods that we use in terms of best practice, and how can we compare the data, for example, in other settings or across countries, for example, and how are the manufacturers sort of hold to account here with what they're producing as well. So we found mapping it to the total product lifecycle approach quite useful. And we did also recognize that we had done, created a threshold for consensus, which is what's recommended in the literature, but we did do some sensitivity analysis around this as well. And about 4 of our statements fell when we changed the threshold of threshold of acceptance by 5 percentage points above or below. But generally, the idea of what kind of stayed and retained were the same ones as well. But I'm happy to speak about the sensitivity analysis a bit more if you would like. The last thing I'm just going to say, and before I wrap up, is that obviously there are limitations in what we looked at. So, for example, our literature review is not exhaustive, and we had a specific time frame to this analysis. So, could we have included other experts in other country settings? We would have loved that. But obviously, there was a constraint around completing this by a certain period of time. I think where I'd like to sit and sort of do the takeaway at the end is really around, where do we go from here? And one was that we really got a better understanding of how data and evidence are being used in these settings and how we could think about they could promote, in this case, more consistency around policy making for data and evidence. But also there's very much a need for clear criteria around how institutions are involved and how they can think about where they should be involved in terms of appropriately for decision making. There's also a space around international engagement. So a lot of countries might be at similar stages. And is there a space here to sort of be discussing and sharing some of these things together? And I think the last 2 points was really around, well, actually, we need to be flexible on the type of evidence that's needed. And I think countries and decision makers are kind of reflecting on that now. And finally, that any kind of strategy that you have around this needs to be agile and needs to be reflective of sort of the current state of play where we are at the moment. So that is my last slide, and I'm going to stop here and hand it back to the chair. So thank you for your attention.
Thank you very much, Divya. So while we're waiting for questions from the audience, by the way, you can type your questions on the chat or raise your virtual hand. So while we're waiting for questions from the audience, Divya, you mentioned that you made a sensitivity. We have one already. So okay, so I'll hand over to Priya for your questions. So
Sure.
Priya, if you don't mind, can you unmute yourself and ask your question to Divya?
Oh, thank you. Hi, Divya.
Hello,
That was
hi.
Hi, I'm joining you from Hong Kong, and I created a mental health app myself for survivors of gender-based violence using AI. And we tested in a very small community. And so I was very curious to learn that only 1% of mental health apps were found to be effective. Could you please shed light on what those apps, what all apps have you surveyed, and what emerged victorious?
Yeah, so I mean, I would say this is probably a couple of years ago, and I think in the space of mental health in particular and apps, it's really, really fast moving. So I think if a systematic review were done now, it might come to different conclusions. I think that was dated 2019 or 2020. It's in the slides. But I think the issue that the authors had is that a lot of the studies were over very short time periods. And I think there was an issue about sort of how well they report this information. So I think that's why they were arguing that they couldn't see obvious changes, I guess, in terms of how that app potentially helped the patient in terms of their, I guess, in terms of either kind of managing their condition or trying to, I guess, understand markers that they were using. So I think it raised not just a question about, how good is the app, but it raised a question about what are the methods that are being used. So are these the most appropriate ways of understanding whether these apps are actually working well or not? So, you have to kind of look at both together. And I think that specific systematic review kind of highlighted the challenges around that. But I'm happy to share that systematic review with you, which is in the slides for further conversation if you'd like.
Thank you so much. I'll probably write to you if that's okay.
Yeah, absolutely.
Also, a fantastic presentation, and thank you for concluding on the note that the digital health policy review needs to be agile. It really needs to be agile. Thank you so much.
Yeah, thank you. Thanks for that feedback.
Yeah. While we're waiting for more questions, you mentioned that you made a sensitivity analysis. Can you tell us a bit more about that one?
Yeah, sure, of course. I wanted to just, purposes of time, wanted to just make sure that we kind of covered everything. So what we did is that we actually looked at, we had a 75% consensus threshold. And what we did is that we thought about understanding, well, what if we change that consensus threshold and moved it 5 percentage points down to 70%, which is what's here on this part of the column, to 80% consensus. And what did that do for where people voted in terms of the percentages that we had? And we found that for a couple of them, that they then would not have hit that threshold if we had to then increase the threshold of acceptance. But the majority of our principles obviously stayed where they were. And I think the other idea that we asked ourselves is, was there any trend in understanding who's voting a certain way? Because we had quite a wide group of representatives actually. And when we looked at that in terms of the types of affiliations experts had, there was consistency in their voting. There was consistency across. It wasn't as if a certain type of affiliation voted a certain way either. So that also gave us some confidence in kind of understanding the qualitative findings here. I mean, I'm used to sort of modeling and doing parameters and changing those. So we did what we could in terms of trying to test, our results here to see how robust they could be. And this is, again, like a first iteration in understanding the framework.
Aside from that, because I don't see any questions from the audience still. Aside from that, I wanted to ask you about like going back to the definition of digital health technologies, whether there was actually a consensus on that actual definition and whether there were divergence on that definition. Could you tell us a bit more about that?
Yeah, I think it's so I think there has been, it's been very limited, I think, in many settings where they might just think about, for example, something that's a platform or something that's just going to be something that's kind of maybe used in a clinical setting, like it's a remote connectivity for a specialist in a hospital to understand, say, a patient's condition if they have some kind of, for example, a pacemaker device or something like that, and feeding that information. And I think there's a recognition, a growing recognition among countries that, you could have things on your phone, you could be wearing things that are tracking your fitness, or, kind of tracking your kind of your diary of activity, for example. And I think that is now a recognition that actually countries have to be thinking about, what matters to them and understanding, where is this activity taking place. But I think before it was very kind of loosely thought through. And I think the World Health Organization definition and some of these kind of, I would say, more at the forefront of understanding some of these technologies, like NICE here in the UK, have really kind of guided many countries to think about how to be quite inclusive in understanding this. And of course, now there's so much talk around AI, which has obviously been used in different ways in terms of particularly around oncology and cancer diagnosis, as well as CT scans and so forth, and trying to understand that technology as well.
And talking again about digital health technologies, and what kind of information actually is used to like assess whether they actually work and whether they actually deliver benefits or whether they're completely useless?
Yeah, and I think that's something that countries are generally grappling with, whether they're in the global north or global south. And the WHO is doing a lot for countries in the global south to sort of figure out what they are looking at in particular. I think what's happened is that quite often you would think like an RCT is the gold standard and that's what you should be using, but it might not necessarily be ethical in every kind of setting or type of condition or intervention you're looking at. And that now applies to digital health technology. So I think countries were quite often using what they would use to kind of test medicines or medical devices and thinking, oh, we need this kind of evidence to understand it. But they're being far more flexible now, which I think is really useful because I think they recognize that not one type of evidence is needed. And I guess it also comes to the type of evidence and how it's generated. Like, do you think about synthetic data? Should you think about simulations? Things like that, which is really pulling in experts in the area of computing sciences and data science to pull on their expertise, because I think it's challenging and opening opportunities for new types of research methods to create evidence here, which I think is a really growing area.
You already touched on that during your talk, but so you touched on the differences that there are among the different countries that you surveyed about their thinking about using like real world data and real world evidence. But could you tell us a bit more about their differences and similarities in using real world data and real world evidence for digital health technologies?
Yeah, so I think what's happened is that there's probably been a bit of in the ones that we looked at, Estonia and Finland have been very much been doing a lot in the area of kind of making lots of things kind of electronic and where systems can read to each other and they can share information very easy, understand not only your health information, but your other statistics and so forth. And they've had kind of the strategy idea where, where they renew it all the time and they want to train their healthcare professionals to be confident in using that. So that they've kind of really been at the forefront, I think, when you look at some countries in Europe, as an example. The UK kind of falls somewhere in between where they've done a lot in certain areas. And they have some great sources of information. I think now they're really recognizing the need to sort of bring them all together. And that's kind of one of the hugest challenges because there's a lot of really rich granular data here, and even in England. Germany's been very kind of late here. There's been obviously culturally lots of issues around data sharing and data privacy. And so that's kind of shifted now their thinking when they realized they could do more on the legislative side to sort of promote that. In Italy, I would say, is interesting because they're regionally kind of organized in terms of their healthcare delivery, and the regional authorities have realized we need to allow for data to be collected. So they're at a point of just beginning to do some of these things. So I would say that in our sample of countries, they're at very different stages. Some of them have kind of been through that phase already, while others are kind of refining where they are. But I think what that lent us to understand is that it doesn't matter kind of where you are in this area. I think it's good to think about these opportunities as quickly as possible and to be proactive, which I think is quite urgent in some respects as well.
Coming back to that comparison, you mentioned that Estonia and Finland were much more advanced in using these digital health technologies, and that in some sense, Germany and Italy were much later in the adoption of these technologies. Do you have a sense of why that actually is, or?
Yeah, so I think in this case of Estonia and Finland, from what we understood in our reviews, is that I think there was a huge public investment in infrastructure in this, for dating back decades, and they've always had kind of 5-year long-term strategies that they really have tried to, when they collect data to get feedback on things, they've really used it to sort of think about how they improve their strategies. In the case of Germany, I think they recognize that they could do a lot more in kind of allowing this, partly being driven by patient demand, also in response to the pandemic, that they should sort of allow for these things to be available. So they've actually now have many things available. The way their sickness funds or their insurers work in Germany is that now they have so many, they have to figure out like how much they should be paying for. So they're kind of now a victim of some of their success, actually. Italy has been slower off the mark in trying to think about some of these things, but now they're recognizing that some regions realize they need to be collecting the data. So I think there is a bit of, you see other things happening in certain parts that centrally the government has come in to say, let's set some standards here and think about how we collect this data. So it does come back to obviously political will effectively, but the infrastructure has really been there in some of these countries a lot long ago than compared to others.
I see no questions from the audience so far, and we're getting close to the hour.
Yeah.
So if there are no questions, I think we can close the session. The next CIVICA seminar is going to be in January. This is the last seminar for this year. So I look forward to seeing you all next year. Thank you all for joining us. And thank you again, Divya, for this talk, for this very, very interesting talk.
Thanks very much.
See you all next year.
Bye.
Bye.